In this video, we're going to look at some myofascial exercises to help with the after effects of an ankle sprain. Most people sprain their ankles through walking on uneven ground or running on uneven ground or through sports or just through tripping. And usually when they sprain the ankle turns outwards and the ligaments that support the joint and the bones can become strained, or in some cases they can even be damaged or tear apart. And when that happens, initially the ankle swells up, it's very painful, it's difficult or impossible to walk on it, and this can last for a couple of weeks. So obviously when this happens, you need to rest, you need to ice the injury, you need to elevate your ankle and allow things to recover. But after the event, once the immediate inflammation of the injury has passed, people find that their ankle remains either a bit unstable or a bit restricted, or indeed both. And this can start to cause problems that can refer to elsewhere in their body. This might sound a bit strange, but if you imagine that you have sprained your left ankle, then the whole time that you have the pain and the inflammation and you can't walk on it properly, you will be putting all your weight onto your right side, your right leg and your right hip. This changes the balance in your body and it can start to create restrictions in the right side of your body because it's suddenly becoming weight-bearing for the whole of your body, as well as causing restrictions in and around the left ankle. So you end up with a body that is less balanced than it was before the injury. If this is not corrected, then over time it can develop into other issues. And I've heard of lots of people who have had a left ankle injury, which has then over time developed into a right shoulder problem due to the tension that transmits through the fascial system in the body. So one way of preventing this from happening is to do some myofascial exercises to release the areas that will be most under pressure. So that is everything from your foot up through your legs to your hips and working on both sides. And this can then help to allow the fascia to loosen and for your body to start to rebalance itself. And if you combine this with ankle rehab exercises to strengthen and improve the range of movement in your ankle, then you can make a full recovery without anything becoming a problem in the future. So in a minute I'm going to stand up and I'm going to use a myofascial ball to work onto the sole of my foot. So standing with the ball under your foot, you can support yourself against a wall or a piece of furniture if that helps, and just roll your foot very slowly, very gently, very progressively over the ball. And waiting to find any areas that feel tender, in which case you wait on these and you wait for these to start to release and let go. Now, importantly, when you're doing this after an ankle sprain, make sure that you keep your leg and your foot stable. You don't twist your foot, which puts pressure on your ankle. And this is why it's a good idea to hold on to something while you're doing this, because the stability in your injured ankle may not be as good as it was before, and you don't want to risk any re-injury. So just rolling gently over the ball, waiting on points that feel tight and sore so that the tissues start to release. And then I'm going to work on the other side using a different ball. So I'm going to work on the other foot using a trigger point ball just to demonstrate. But in actual fact, when you are doing this at home, I would recommend that you use the big ball first and then the trigger point ball. So again, placing the ball on the floor, put your foot on the ball, support yourself, and just roll very gently and slowly over the ball, finding areas that feel tight and sore, and waiting for these to release. When you have had an ankle sprain, it will affect your foot and it will affect both feet. So not just the side that's been injured, the other side, which is weight bearing, will have had more pressure on the foot. So you may actually find that the weight-bearing foot is actually more tender than the foot on the injured side, which is why it's always a good idea to work on both sides. Doing this regularly can really help to loosen your feet, and as your feet loosen, it creates a chain reaction up through your legs, through your body, of the tissues starting to release and let go. In this exercise, I'm going to use a myofascial ball to work on my shins. The shins at the front of your lower leg have a muscle that comes right the way down the outside, and then it comes right the way down over your ankle and then round and wraps under your foot. And when you've had an ankle sprain, this muscle can become damaged too, because it gets pulled as part of the sprain. There are a lot of fascial connections between the muscle and the bone that run right the way down the front of your shin, and these can become tight as well. So by releasing your shin, you are helping to release the whole of the structure that supports your ankle and your foot. To do this exercise, I'm going to just come into a position where I've got this leg on a right angle, and I place the ball under the muscle, and I can just lean in, allowing my leg to relax around the ball. And just waiting for a sense of things starting to release and let go. It can feel quite tender here. So just allowing things to release. And as they do, the tissues will soften and the pain should start to subside. And you can move the ball further down to different points on the shin, allowing things to release and let go. And then we can turn to work on the other side. So again, I just have my leg at a right angle, and I'm just going to place the ball underneath and just lean in. So waiting for a sense of things just starting to release and let go. It's important to work on both sides, as the injured side will have restrictions caused by the ankle sprain, and the other side will have restrictions caused by weight bearing while the ankle repaired itself. So you can work at different points on your shin muscle to allow things to release and let go. And each time you move the ball, making sure that you stay in that place for at least a couple of minutes to allow time for the tissues to release and let go. In this exercise, we're going to do a stretch for the front of the legs. When you have an ankle sprain, the whole of the front of your legs can become tight and imbalanced as a result of the injury. And so releasing these can help to release restrictions that may have formed and that may be pulling your body off balance, as well as helping to stretch out the area around the ankle itself. So the easiest way to do a whole front of leg stretch is to kneel with your feet flat on the ground. It's stretching the front of your feet, the front of your ankles, your shins, round your knees and into your quads. If you feel that this is too much to be in this position, you can reduce the stretch while staying in the position by putting a pillow between your upper and lower legs. And then this can feel more comfortable. However, on the other hand, if you'd like to have a deeper stretch, then removing the pillow, you can lean back. And this will create a deeper stretch that you will feel all the way through the front of your legs. The important thing with this exercise is to make sure that your feet are parallel. You don't have them twisted, so that you're not putting any extra pressure on the ankles. And so for as long as you're here for at least a couple of minutes, then the tissues will be starting to release and let go. And you'll feel a progressive softening and stretching of the tissues, and maybe get a sense of wanting to drop further back into a deeper stretch. In this exercise, we're going to do a stretch for the back of the legs. So to do this, I'm using an exercise step here, but if you have steps at home or a staircase, then you can use these. Make sure that you hold on to something when you're doing this so that you keep your body stable, and in particular that you keep your feet and your legs facing in the same direction and you're not starting to twist your ankles or your legs. So coming on to the step, I'm just going to allow my heels to drop off the back of the step. And what this is doing is it's starting to stretch the back of my legs. It will stretch everything from my feet through the backs of my ankles and the Achilles tendon, which attaches into the ankles, my calves, and up into my hamstrings. And actually it will stretch all the way up into my glutes, so also helping my hips. This will start to release some of the restrictions that will have formed as a result of the ankle sprain, and in particular allow your lower legs to start to release more. But also it's helping your calves, it's helping the hamstrings, it's helping to rebalance your body. It's a nice easy way to do a stretch for the whole of the back of your legs without having to do separate stretches for each individual part. And because gravity is doing the work, your body weight is creating the stretch. And as long as you're here for at least a couple of minutes, then this will be allowing your body to stretch and release and allowing the tissues to let go and soften. In this exercise, we're going to do a spine twist. This helps to loosen round the sides of the hips. These can become tight and restricted when you've had an ankle sprain, and it can result in you walking and using your legs differently. So the more you can do to release round your hips, it will actually help with better movement of the whole of your legs and help the recovery from your ankle sprain. So we're going to start by lying on my back with my knees bent. And then I'm going to drop my knees over to the side. And when you do this, if your knees are not touching, then you can use a pillow just to support the top leg. And this just means that I can relax my body, I can relax both of my legs and allow the tissues to start to soften and release. And the area that it will affect is around the side of the hips here, where you have all the muscles and the fascia that rotate your legs as you walk and help to support your legs as you stand. So just noticing how this feels. And if you want to have a deeper stretch, then you can straighten your top leg. So this will create more of a stretch that you can feel round into the side of your hip. And this is just allowing things to start to loosen and let go. And just allowing your body to be nice and heavy and relaxed. Allowing the weight of your leg to create the stretch without you actively having to do anything. And as you're here, just noticing how your body feels. And as long as you're here for at least a couple of minutes, then the fascia, the muscles, all the soft tissues will be starting to release and let go. And so we can do the same thing on the other side. So dropping my legs down to the other side. Again, I can put a pillow between my legs just to support my top knee. And allowing my body to just start to release and let go. Noticing the difference between the two sides. This is where you might start to notice that actually the side that was not injured may well be tighter because it's been weight bearing while the ankle has been repairing itself and recovering. And that's a very common thing to notice. If you want to have a deeper stretch on this side, again you can straighten your top leg out. And just allow the weight of your leg to start to create a deeper stretch into the side of your hip. So as you're here, just allowing things to relax, become heavy, allowing the stretch to deepen. And as long as you're here for at least a couple of minutes, then the tissues, the fascia, will be starting to release and let go. You can find more self-help videos like this on our YouTube channel, or visit our website where you can find out more information about myofascial release and buy our myofascial release ball kits.